A warm welcome to you from Geneva, Switzerland. I'm Rada Sadki from the Geneva Learning Foundation, and I'm here with Charlotte Mbu, also from the foundation, who is in Ebolova, Cameroon. A warm welcome to you for this event. It's the first time that the Geneva Learning Foundation is doing anything like this. We want to recognize the partners and the colleagues and many health professionals who responded to this. We'll explain to you why we've been actually quite overwhelmed by the response to this event, because a remarkable number of health professionals registered to and contributed, 4,700. You'll be hearing their voices, their insights in just over 2 minutes. We'll see you soon. If you're watching, joining us from YouTube, Facebook, Twitter, LinkedIn, wherever you are, whichever country, whichever platform, let us know. As you can see here in the Zoom studio, our guests of honor are introducing themselves from Nigeria, Libya, Kenya, and many, many other countries. Hello to Hussein Sheikh Ahmed from Somalia, already starting to share experiences here. All right, countdown with me. It's 1 minute, 10 seconds. We're almost at the 1 minute mark. This is a first ever for us and perhaps also for you. A warm welcome to Isamu Ould Hanifi. Says salut, but I believe you're bilingual. Tell us, Isamu, where you're connecting from. And a warm welcome to Diana Youssef, who's connecting via LinkedIn. Tell us where you're coming from as well and why you care about climate health. All right, we also welcome folks in our Zoom studio who are introducing themselves. Obanglamesh, Charles Lam, Olajide Odugmebi. You can see as we count down 30 seconds now. All right, and welcome back, Dr. Hudu from Nigeria. Great always being here. A very warm welcome to you and so many others who are joining across social media platforms. And I'm impressed by the number in our Zoom studio. 13, 12, 11. This is a first. We believe this could be an historic moment for health professionals. The first time frontline health professionals. You'll see why we're so excited about this event at the Geneva Learning Foundation. And this is the first number we're pleased to share with you, is that 4,700 health professionals registered for this special event. So this, even if you are alone in front of your computer screen, I'd like to ask you to do something very human, very simple, is to put your hands together, because this shows we really struck a chord amongst frontline health professionals. I'm here and pleased to introduce my colleague Charlotte Mbu. I don't need to be on twice. Charlotte, how are you doing in one sentence?
I am doing great, Reda, and I just want to say hello, everyone. Special welcome to those who are joining us today for the very first time.
All right, wonderful. If you have poor connectivity, be assured we have a podcast. You'll be able to catch up on the audio afterwards. That's really important. And now you are sitting in front of your computer screen by yourself. But think about it, 4,700 colleagues from all over the world. If we were to come together in the physical space, it would be something like this. Or perhaps it would be sort of a multi-story affair with people with dialogue and people sharing experience and everything we're hoping to have happen today. And if you think about all of these observations in a sort of colorful, imaginative way, maybe this event actually looks like this somewhere. But what we're interested in, and to kick off, is the following question. We are going to hear from Mildred Akandinda. Is climate change a threat, in her view, to the health of those you serve, and why? And the challenge is to answer this in one single sentence. I hope Mildred is not going to have connectivity problems. There will be at least one speaker who drops off because we are reaching and including people on the front lines. And that means connectivity is not the same as in Geneva, London, Seattle, or Washington. Mildred, are you able to speak to us? I'm asking you to unmute. Otherwise, yes.
Oh, yes. Hello, everyone. Nice to meet you. I am Kanda Mildred. I work with Kampala International University within a hospital setting. And the question is climate change a threat to health of the people you serve? Yes, because there is malnutrition, being a food production, so people suffer because the rain come and destruct the environment and the food. Therefore, the children are seen with a number of malnutrition increasing. I thank you.
Wonderful. Now we go to Jesu Miwale Adeniji. Introduce yourself. And again, the question is climate change, in your view as a health professional, a threat to the health of those you serve, and why?
Thank you. My name is Jesu Miwale John Adeniji, the Executive Director, John Gates Development and Empowerment Foundation, Nigeria. Yes, climate change is a threat to the earth for those that serve. Is yes, because the ozone layer is now a threat to our system. The heat is somehow unbearable. And the rainy year is caused a lot of flood to the society at large, and people cannot move from one town to another town. That's for African system where we are experiencing, and it causes a lot of new diseases and sicknesses around us. Communicable diseases that we have to look for a way out. So it's affecting us seriously.
Thank you very much. Thank you very much indeed, Jesupe Miwale. We'll come back and we'll deep dive into the observations that you and you'll see how many have actually shared our observations. It's impressive. I just want to say for Isamu Ul-Hanifi, who asks to democratize this discussion by allowing francophones. Sorry, Isamu, you just missed the French language event, but you can catch up by watching the recording. We feel that language interpretation kills the dynamics, the energy in the room. Now, we do have some rules for fairness on speaking in the in these special events, and you'll be hearing Charlotte make these decisions on the fly as we go, because none of this is scripted. You are here. We've invited you as our guests of honor in the Zoom studio. Many more people following on the social media channels, and so here we are. 1,234 observations by country. So each observation is a health professional who answered questions about what's changing with climate, what's changing with health, and what difference is making. So we asked 1,234 respondents. 1,234 responded. It's a funny number, but that's a coincidence. What's important here is that we asked about what do you think is the sort of severity of the threat, and you give it the highest threat level rating. The same, we asked, do you worry about climate change sort of in general? And again, here you see 822 gave the highest sort of sentiment of worry about climate change. Now we asked, are changes in climate and health related? Where you work, so this is in your district, in your village, in your area. And again, 1,000, basically almost everyone said, I believe they're related. Now we also ask you why, and it's difficult to prove that causal relationship, and you know that. But you're also witnesses and partners to local communities that you live with and work with every day and tend to their health. So we believe there must be some reliability to the observations that you have shared. Now you may be wondering who is sharing, who are we as a community of health professionals concerned about this? And so job roles, you can see that you've got a healthy mix. People who are medical doctors and public health specialists, that's the biggest contingent, but also nurses, midwives, pharmacists, and community health workers. So you've got a well-rounded set of people in very different, obviously, locations, but also job roles and perspectives to bring to the table. Now, who do you work for? You can see the biggest number, 673, are government workers. The second largest group are people from NGOs. So this is not civil society activism. This is government workers sharing concern about what is happening with climate and health, even though for most of you, that is not part of your job. Most of you, we know, work in immunization. And you can see then there's a kind of long trail of people working in other areas. Now, we also asked ourselves, well, is this coming from big cities? Is this coming from people in remote areas? And in this very early analysis, we're able to see that we're talking about observations made in smaller communities and then in mid-sized towns. And we'll be sharing a lot more as we progress in the analyses, and we'll be giving back to you what we learn as we learn it. That's a key principle at the Geneva Learning Foundation. Now, we also asked, at what level of the health system do we work? And in fact, most of you, again, work at the local levels, district, facility, and then you also have a healthy contingent working at the regional level, at the national level, many of you in the Ministry of Health again, and then internationals as well, sharing their local observations because they also live in a place that is local. Last but not least, we asked you what describes your relationship to the community. And so that is a particularly important question with respect to the kinds of observations that you're able to make. Are you part of the family? And it turns out that a majority of you are. Or are you a trusted friend, a regular visitor, an occasional guest, or a stranger? So that is, again, who we are as a group. You answered questions, shared your individual observations, and we wanted to give you a sense of who we are as a group of, again, this amazing number, 4,700 health professionals who registered and who contributed, 1,234 of whom contributed by sharing their observations. Now I see there's a lot happening both on social media. Of course, I wanted to get through this initial presentation, just still people sharing their greetings. So pharmacist Bernard Badou Bediaco, Dorcas Mirni, Onia Olasade Julius, and then from, let me go back to social media. Well, Charlotte, of course, we are now going to ask you basically the questions you answered to share your observations again. Today, we're not going into the actions that we may want to explore in the future. I'll be sharing what's next after this special event, but that is where we're going to start. We'll come back to social media in a minute. Charlotte, who shall we hear from first?
Already, I've invited Collins Mwesikwa to unmute, and if you like to answer those questions, please go ahead and raise your hand. Collins Mwesikwa, if you're able to unmute yourself, over to you. There is also Safianu Haruna.
Or maybe we can go to Monica Agu. She's the first. All right.
Yeah, to unmute.
Monica, are you there?
Hello.
Hello.
Yes, wonderful, Monica. Please introduce yourself. And then the challenge is, again, to be concise and get to the point. Think about your colleagues who are also wanting to speak. What we're interested in is what changes. First of all, tell us who you are and about the community that you serve as a health professional. What changes in the environment? What changes in health? And how do you know that they're related? Because almost everyone thinks that they are.
My name is Monica Agu. I am a pharmacist, and I work as a community pharmacist in Aja, which is state. It is a community of about 150,000 people, and it is on the same level with it's a sea level. So the climate change has resulted in a lot of rainfall and serious flooding. Many streets are flooded, pools of water everywhere, and this breeds a lot of mosquitoes. So many people come to my pharmacy, we're coming down with malaria. They will get treated, and within few weeks they are back because they get bitten. And unfortunately, most of them don't want to use mosquito nets because we have power issue in this area. So sleeping under the mosquito nets will be unbearable. So many of them don't sleep with their mosquito nets, and they keep getting malaria over and over again. Another is that a lot of streets are flooded and the water is dirty. Some of them having growths like spirogyra, and people have to dip their legs in this water to be able to come out. They come to pharmacy complaining, I have these infections on my feet, it's very itchy, and a lot of skin diseases are coming up. And a lot of typhoid and diseases are also on the rampant. So this is as a result of climate change, because the areas at sea level where it floods, everywhere is flooded. Not only the streets, even the houses are flooded. People lose their property. There is a school that the school compound and the ground floor everywhere flooded. Children have to remove their shoes, step in the water to go, and obviously the rooms on the ground level, they have to go upstairs. So climate change is a serious threat to health. And the signs are there. These diseases coming, malaria, skin infestations, typhoid diseases, and even mental health, because people are anxious. When rain is about to fall, people are very scared. What will be the result? So many people, it affects them psychologically. And with the present situation in Nigeria right now, it's with a lot of social economic issues coming up, it compounds the problem. That's sometimes you see somebody that is supposed to be healthy on the street walking, and by the gesture the person is making, you know that the person is already losing it. The person is having psychiatric issues. So they are related. And it's something that all of us have to join hands to be able to do the much we can to educate our communities on what they can do. For instance, not disposing in the drains, because that also helps to worsen the issues. When the drains are blocked, then the flooding remains and enter the houses and homes and streets, and it makes it worse. Thank you very much.
Thank you very much indeed. That was quite powerful. Thank you. Looking forward to hearing more from colleagues. And again, 1,234 of you took the time to share observations before the meeting, but you did it alone in front of your computer or your phone. Here we are together, coming together for the very first time as what could be a community to think and do around these issues that you are concerned about as health professionals. Now, Charlotte, who's next?
So we have Collins Mesfigwa, whose microphone is open now. Whether he's the man, and I'm sure he's not from Nigeria, as we try to respect our rules of equity. So over to you, Collins.
Hello, my name is Mwes. Hello?
Yes, we hear you loud and clear, so please be concise and get to the point.
Am I clear?
Yes, you are. Introduce yourself, tell us about your community, and then what changes in the environment, what changes in health, and how do you know they're related?
My name is Mwes Collins Davis. I'm a retired public health officer, but attached to Ministry of Health, EPI section and cold chain. There's a great linkage between climate and health, and climate and health are interlinked because any change in climate affects the air we breathe, the food we eat, the water we use and drink, and the places that provide us with shelter. Climate change can as well affect people, can affect communities.
Collins, you're absolutely right with everything you're saying. What we're interested in is, what have you observed? What have you seen in the community where you work on cold chain for vaccines? What is changing, and what have you observed personally and directly as a health professional?
I have seen frequencies. I have seen changes in most cases where the communities cry because of the climate change, because of the drought, because of the floods. Take, for instance, in Uganda, we recently have had many floods where people were displaced, landslides, and people had to be reallocated to different places. And in so doing, if the community has looked for immunization activities, services, of course, when the whole village and the whole community are disturbed and are dislodged, then there are no services. So eventually, our low coverage of immunization is not all that to the standard we want. And secondly, when there is a lot of drought, I've seen people living living hungry, people having no food, people going to look for food in other areas. So climate change has brought a lot of effects on the communities in our nation and the world at large.
Thank you, Collins Mesfigwa, for sharing your observations. We're talking about climate change and health, but it is health professionals from the front lines of climate change who are doing the talking today, and we are listening and learning with you. Back to you, Charlotte. Maybe we'll do a quick detour on social media. There are many comments, but right now it's Jonathan Atangwire saying thanks. Jonathan, tell us more. We know you're joining from Uganda. What why are you concerned? Do you feel it's a threat to your community, this climate change? And Rianne Tenveen, great to read so many joining. Sorry I can't join by Zoom. Greetings from the Netherlands, she says. Halimat Adeji Adenola says, it's a pleasure to be here. A warm welcome to you. Tell us, do you think that climate change is a threat to the communities that you serve as a health professional? We have an anonymous LinkedIn user saying hello from Abuja. And then Dr. Subarna Sinha Mahapatra from India. Subarna, tell us what your concerns, what your thoughts are about climate change and health as well. We're reading your comments on LinkedIn, YouTube, where these comments are coming from, as well as here in the Zoom room. Let's see what's happening here. Omar Tabalis is still saying hello. Olaide and Uninse Ametorwodulia. We're looking to and we'll be sharing the comments from the Zoom chat as well with everyone. Back to you, Charlotte.
Thank you, Reda. I am inviting Dorcas Merny. Are you able to unmute yourself? Your hand was raised. Okay.
Yeah.
Over to you.
Good afternoon, everybody. I am Mrs. Dorcas Merny from Nigeria. I work with Federal Ministry of Health as a nurse, and my relation with my community is very cordial. Where I live, there is extreme heat, and the heat affects both humans, animals, and the environment.
Hello.
And once this happens, people are dehydrated.
Hello.
Yes,
If they don't,
Dorcas, are listening.
this can lead to coma.
All right, sorry, Dorcas.
Dorcas,
I think there's another person who keeps unmuting, so that's why you're hearing interference.
Joseph Ngugi will come to you afterwards. So Dorcas, please go ahead.
And you'll need to unmute again because we accidentally muted you. And this is normal, and this is just happens. That's what we get, connecting people from all over the world. Looks like we've lost Dorcas. It's funny how it's there's a difficulty in coming back. Charlotte, I see many raised hands.
She's actually
okay, she's back. Great. Go ahead, Dorcas.
Both on humans, animals, and the environment we stay in. Thank you.
All right. Dorcas, I believe you were muted for a little bit, but thank you for sharing your observations and your experience.
Thank you.
And we will go to Joseph and Ngugi next then. And Joseph, I hope that wasn't accidentally unmuting.
Yeah. You can hear me now?
Yes, indeed. And Joseph, you are a pillar of the immunization community of the Geneva Learning Foundation. You're also a leader in the movement for Immunization Agenda 2030. Warm welcome to you. Be concise and get to the point. Remind us who you are, what you do, and tell us about these changes that are of concern to you.
Yeah, thank you. Good morning, good evening. Joseph Ngugi from Murang'a County in Kenya. The challenges the climate change has affected my community because of the weather changes. They are forced to scrabble for the small rad we have, which they invade the multinational farms, whereby we end up having conflict, injuries. Some children missing the immunization because the fathers are hospitalized or the mother are hospitalized. Those are all the things. The girls now getting early pregnancies, others missing immunization, and others missing school because now the house girls now because of the climate change now they become the house girls. That is how it has affected my community. Thank you.
Thank you, Joseph. All right. Charlotte, all right, we can go to Ikhtiar Kandakar. Let's go to Ikhtiar Kandakar. And I hope you'll correct the pronunciation of your name. Please do introduce yourself and then tell us about the community you serve as a health professional, and then what changes have you concerned? How do you know? Why do you believe they're related? But
thank you very much. Good evening from Bangladesh side. This is Dr. Ikhtiar. I'm the Director Health Program for Care Bangladesh. I'm basically actually working at the national levels, but we have very good connections with the communities level when we do our own planning for anything to do that for related to the health. So the main challenge is related to the climate change in Bangladesh. Basically, there are a number of changes are noticed at this moment, which was not before, like the new actually environmental the issues are coming up, like we are experiencing heats ever before, never we actually experienced that. And there are a number of health related issues coming up due to that extreme heat weather. So the communities are experiencing, but they are not used to actually have that. And there are a number of health issues are coming up due to that extreme weathers. And also we are very prone to the different climate change impact, like frequent flood, cyclones. So these are ultimately impacting the peoples from the communities to move from one place to another. And when they move from one place to another, their service accesses are interrupted, like immunization, reproductive health, family planning services. So they are in deep crisis situations when these things are actually repeatedly happening. So climate change has a great impact on the health of our communities. So yeah, and they are not prepared as a community. They are not prepared how to adapt these situations, and also our health system is not prepared how to actually address these situations. So this is a combined challenges actually we are working, but it requires a lot of times to fix it. Thank you.
Thank you very much indeed, Ikhtiar Kandakar from Bangladesh. Charlotte, who shall we hear from next? And I take note of the, we've moved beyond the introductions, and I think we're beginning to see comments and sharing of experience in the chat in the Zoom studio. I do want to acknowledge Israel Onyenuche, who says, it's a big treat in Yobe communities that earlier have water scarcity are now being flooded, and people are losing their homes and means of livelihood. And he sent me a follow-up message, probably frustrated not to see his message right away. Are you there? So yes, we're here. There is a bit of a delay between the live stream and what you see and what we have here in the Zoom studio. Back to you, Charlotte.
Yes, Reda, we have Akelo Rebecca that's already unmuted. Over to you, Rebecca.
Good afternoon, everyone. My name is Rebecca Akelo, a public health nurse working in Kome district in Uganda. I realize to add my voice on the rest of what people have said, it's true. Climate change has a very big relation to the health of the population. Me, as a person working with immunization, the greatest challenge that I have realized or recorded during the dry spells where there is no food, children come and their growth monitoring, when it is taken, they really score a low weight for age, and indicating that even mothers who are breastfeeding do not get enough food in order to get enough milk for the children. And those children that are feeding do not get balanced diet. That is in relation to immunization as a department, but other things still remain the same. It applies to Kumi as well. Thank you very much.
Thank you very much indeed, Akelo Rebecca. Let's see if we have many more comments here. Ibrahim Abdullahi says, from Bauchi State in Nigeria, says he had more than 400 healthcare workers working towards achieving healthcare services. Okay, that's wonderful. Ibrahim, what we want to know is what observations you're making about climate and its relationship to health. Felix Collet, Charlotte has unmuted you. You can see the questions up on the screen. Please be concise and get to the point.
Yeah, good afternoon. Are you getting me?
Yes, loud and clear.
Good, thank you. My name is Felix Colley from the Gambia, working with the Ministry of Health as one of the health communication. Yes, definitely the question is yes, climate health has definitely affected humanity. Coming to my area where I live and where I work, initially, we used to get a lot of good wells around the coast, but now those wells has turned to salty water just because of the rise of the ozone water. Of course, when it comes to heat, nowadays, people are no longer sleeping inside their houses, which is also very stressful on them. Because when there is no electricity, obviously nobody can be inside. They rather come outside. That sometimes warrant theft issues and other things like that. Because when they are outside, their doors are compromised, and others can easily sneak in and get what they need by stealing. And also, we have realized a lot of erosion has been occurring within our end. That has washed away all the fertile soil, which result to compromise the production of foods, which result to malnutrition and other food insecurity. So definitely, climate change has definitely affected our human life. Back to you. Thank you.
Thank you very much indeed. Take note of a comment from Subarna Sinha Mahapatra, who says, considering the health impact of climate change, the Ministry of Health and Family Welfare, the Government of India, launched a national program named National Program on Climate Change and Human Health, and that was back in 2019. All right, we're almost at the halfway mark. We'll hear from one more person before reaching the 30-minute mark, I believe. Let me see if Charlotte has already unmuted someone. Yep.
Irene Uma.
Yes. Hello.
Yeah.
Hello, I'm Irene Uma. I work in Kende Health Center in Homa Bay County, and I'm a nurse by profession. In my community, I serve 123,000 people around the area in Suba Sub-County. And I've seen a lot of environmental changes within Suba Sub-County. That is extreme temperatures has resulted to low rainfall, that has resulted to poor sanitation, especially lack of water, which has led to many skin diseases such as scabies. I've seen a lot of children coming with scabies. I've seen a lot of GIT cases, that is gastrointestinal cases. I've seen a lot of snake bites due to hot temperature because they're looking for cool areas. So I think health and the climate change are very related. And recently in Suba Sub-County, we had some cholera cases. We had a few faculties, around 7 deaths and a lot of cases. And this is because of climate change and poor sanitation. Thank you.
Thank you very much indeed. I take note of the comments from Aminu Yahaya and Wasim Zaman, who says, can we have another 15 minutes? I meant to mark a pause, not to finish the event. And we'll be turning to two of our guides on the side, partners and friends and colleagues in some cases, who have joined to listen and learn from you, with you, from your experiences and your observations on the ground. So we'll have we'll now go into, and I'm going to tell you about what is coming next. But first, I'd like to share a little bit about here why you matter. And this would be my preferred title for this editorial, shared with co-authored with our partner Bridges to Development, written by Dr. Julie Jacobson, a former president of the American Society for Tropical Medicine and Hygiene, and her partner and co-founder Alan Brooks is in the room in our Zoom studio today. We'll be turning to him to ask, but I encourage you to go and check out this editorial, our thoughts on why you matter. Second is very pleased to hear and to announce right now, I was going to wait until the end of the special event, is that in partnership with the University College of London, the Relief Center team based in Beirut and other partners, we're going to be offering the first citizen science workshop for you, for health professionals concerned about climate and health. And the invitation will be shared with everyone who shared their observations. That's a bit of a negative formulation that you see on the screen. Sorry about that, but it's really quite positive. We want to really, if you took the time, if you felt concerned enough that you took the time to share your observations, you'll be receiving this invitation, and the event will be taking place on Wednesday. This will be more of a hands-on workshop. You'll be hearing what is citizen science, how can you, as a health professional, you're not only a citizen, you also have those professional qualifications. The UCL team, the Relief Project team will be presenting, and discussing with you what's available, what tools you can have at your disposal as you think, as we move from thinking the initial observations towards action around that makes sense to you in your local context. Next after that is Teach to Reach 9. We'll be having a special session again on this theme, but this time focusing on peer learning and networking, so you can share, connect, meet, network, and learn with your colleagues. We'll also be we're also preparing version 2 of the Manifesto for Global Health that will be presented on the 13th of October at Teach to Reach 9. And then last but not least, we've initiated the discussion now with the COP28 team on planning for a special event. So COP is the Conference of Parties, of course, the international conference on this on climate in general, that for the first time on Sunday, December 3rd, we'll be holding a special session specifically on climate and health. We proposed 2 days before to hold a special event this time with you sharing the call to action that you will have. You will be invited to elaborate in the coming months. So that's it for the announcements. I'm now going to turn to Alan Brooks as well as his colleague Mark Booth, so they can briefly introduce themselves. And Alan Brooks is our partner from Bridges to Development. Alan, you've listened to the first half of this special event. What's on your mind? What would you like to share back as you've been listening and learning from health practitioners working in many, many different countries?
Yeah, good afternoon, good morning, everyone. I'm Alan Brooks, and I'm really pleased to be joining and listening, hearing, and most importantly, learning from the many reflections that you brought out. And just to fair to answer the question, in my community, particularly the increased heat has led to significant increased risk of death, and particularly for the elderly, who are particularly vulnerable to the heat. And also the particularly vulnerable to the heat, of course, are the very young. And we heard about some of the comments earlier about the impact of the climate change that people are seeing on children, on infants, and also on their mothers. I wanted to speak briefly and reflect on a comment that Dr. Ikhtiar from Bangladesh made, that communities and health systems are not prepared. And this is part of why I was so interested to listen to and for us to begin this discussion, because it is absolutely critical that things like the international organizations and the global community, yes, take steps to mitigate and to decrease and mitigate the impact of climate change. Absolutely. And yet it's each of us individually in the communities within we're working as we've just heard, that are actually going to be on the front lines of this, that are going to be living with and supporting our communities, and to find our way through this incredible challenge. Whether that's the increased malaria that Jeffrey Mutale referenced in the chat, seeing because of the additional flooding and therefore the additional mosquitoes that are showing up, whether it's the work that Mildred Akinda spoke about in the chat about Mission Green and the work that she's part of in Uganda to help to bring climate change and health related issues and mitigate that into the local communities. You know, each of these are challenges that we're going to need to collectively figure out how to take on, but the solutions have to be local, have to be about each of you as individuals. And that's what I'm taking away from this, is that you are seeing this challenge, and that you're saying that actually we need as a community and as health practitioners to step up and take that challenge on. So kudos to you. I'm sorry that we are on this journey together, and I am deeply glad and relieved that we are on this journey together. So thank you, Retta. Back to you. And again, really impressive reflections and thoughts shared prior to and during this event. Thanks for organizing it.
Over to Mark Booth now. A quick one-sentence introduction, and again, in the few sentences as you can, what have you taken away from this, from listening and learning to these health practitioners today?
Hello, good morning, evening, and afternoon, wherever you are. My name is Mark Booth. I'm an academic based in the north of England at Newcastle University, and I have a background in researching climate change and infectious diseases affecting people across the world, but particularly in sub-Saharan Africa. I'm really humbled by listening to yourselves speaking about the effects that are affecting your populations directly. Of course, in the north of England, it's not so bad at the moment. In fact, most people are enjoying their gardens more because it's just about warm enough. But of course, then they're sort of not so worried. And I can hear the worry in your voices, and I really respect the time that you're giving to tell us about what's happening to you directly. I've done some work in Africa in particular, and I've seen firsthand what happens to communities that are very vulnerable to infectious diseases as the environment changes, even on a small scale. And we should remember, hopefully, that climate change, although it's a global phenomenon, is affecting very, very locally people in very different ways. And I again, thank you very much for sharing your observations, and I'll reflect on those.
Thank you very much indeed, Mark Booth. And now back to the sharing of experience. Thank you to our guides on the side. Back to you, Charlotte. Who shall we hear from next?
I'm inviting Dr. Mohamed Yakubu to go ahead, answer the questions concisely, precisely after introducing yourself. Over to you.
Okay. Thank you, Charlotte. Thank you, Reda. Good morning. Good afternoon. Good evening. I'm Mohamed Yakubu. I'm a medical doctor. I'm working with Gombe State Ministry of Health. The climate change actually had a positive impact. It affects our health directly and indirectly. And with my experience, I'm working with the Ministry of Health for 5 years. So from my experience, climate change affects health of people, from the children up to the adults. Especially now that we are in the rainy season, we have been recording a number of cases of malaria, from simple malaria to complicated malaria, because of the excessive rainfall that's causing vectors to be widely separate, and then causing malaria. Also, we've been recording the cases of malnutrition due to the excessive rainfall, which damage foods and then the plants. Understand? So this one cause malnutrition in the children. Like in the hot weather, like in the case of extreme temperature, like in hot weather, we have been recording cases of dehydration, and people with diabetes mellitus came with hyperglycemia and other complications. And currently, as I'm talking to you now, Nigeria had the first case of anthrax. And I think and I hope this case is due to the climate change that impact the human. And also now we have been having cases of diphtheria all over the country. So also, and then we have been recording cases of morbidity and mortality due to the climate change, and especially when in the cases of excess rainfall, it caused damage to infrastructural development of the hospital and other households, which causes collapse of building and other things that causes injury to humans and loss of life. And also it leads to also a psychological problems of people who come with psychological trauma, because when there's excessive rainfall, people will be thinking that their building will fall and they fall asleep, sick. So in nutshell, actually the climate change has actually positive impact, and it has direct impact and directly affecting health of human beings. Thank you.
Okay, we understand what you mean by positive, but thank you, Dr. Mohamed Yakubu. Yeah. All right, Charlotte, who's next?
Brother, I want to turn to Wasim Zaman. Wasim, are you able to unmute yourself? Or we can listen to Halima. Okay, Wasim, over to you.
Hello.
Brief.
Dr. Wasim Zaman here from Pakistan. I am a district surveillance coordinator at Khushab district, and we work on the district level We have a combined population of 13.5 lakh in Khushab. Now, I want to say about the climatic change. As you have heard of Pakistan, in the last few months, we have been facing the floods. That has disrupted almost 50% of the country. And that's why we are always having this kind of things when the glaciers melt. And we always go up through. And there lacks a planning. Of course, there lacks a planning that our departments should be vigilant about, that if they are expecting the climatic change, they should have worked. But the thing is, when we face this kind of floods and calamities, so the disruption of immunization campaigns and the disruption of everything takes place, and we are always short of the manpower resources, as we have to meet different challenges. So health emergency is one of them, and when the health emergency arises, then we always face the different budgetary effects. So this is what we are facing in these kind of situations. But at district level, we always make some plans, keeping in view the climatic changes and upcoming pandemics or epidemics which might break out in case of the calamities. So I would like to share the plans later in whenever given the opportunity, and inshallah, as we're working with all others, we'll try our level best to work as a community, learning from the experiences of the whole world. Thank you.
Thank you very much indeed. I'd like to go now to Avua Oteri. And so, Avua, you wrote in response to one of the stories from Nigeria that, in your view, the diphtheria outbreak in Nigeria cannot be linked to climate change, except it disrupts immunization services. You have two. You're connected twice, probably once with your phone, once with your computer. I'm asking you to unmute on both. We'd like to hear firsthand what you have to say on this topic before we hear the next sharing of observations. Avua, yes, are you able to speak? So do introduce yourself, tell us who you are and what you do, and then tell us what is your concern with the story that you heard. And we're not going to get into a debate or an argument, but we do want to hear what is your, what can you tell us more, elaborate on your comment?
Okay, thank you very much. My name is Avua Oteri. I work as an immunization advisor at Nigerian Governors Forum. When we talk about climate change, we look at it from the aspect of how, if it disrupts immunization, then you can say the current diphtheria outbreak could be linked to it. But outside that, I don't think the outbreak we're having in the country is linked to climate change, because if it's climate change, it can be happening in almost all the states at the same time, because we don't have the same climatic pressure. Even though we have rains, if you say rain disrupted services from happening, it's possible, but the only example I can give is Bayelsa State, one of the states that oversee at the Governors Forum. And I know that last year, there was a very massive flood that disrupted virtually all services, including immunization. Most of the cold chain equipment were damaged, and the state had to prophylactically disconnect most of the equipment they had. And during that period, most of the communities were living in IDP camps, and immunization was not happening. So at that time, they had a very low coverage due to that flood. So if the diphtheria is happening after that, then you could say yes, because of poor immunization. But luckily, Bayelsa is not one of the states that have diphtheria. So I don't want us to twist it that diphtheria outbreak is linked to climate change. So we don't get it. Thank you so much.
Thank you for that clarification. There's obviously a lot of complex underlying issues. What we're doing in this session, and let's be very clear, is we're limiting it to what are your direct observations as health professionals, how we interpret that, how we make sense of that, how we actually prove or disprove the causal relationship or correlation. That would require a lot more time, a lot more investigation. But at this stage, we're interested in hearing your firsthand observations. Back to you, Charlotte. Who's next?
Thank you, Reda. I see Geoffrey Mutali. Your microphone is already unmuted.
Right,
so over to you.
Is it?
What will go to you?
Yeah, is it my, am I mistaken, or have there been a series of men speaking one right after the other? Just keeping in mind there are rules for fairness and equity, and I know you're doing everything you can to keep
Hello,
that
can you
balance.
hear me?
Yes, Jeffrey, go ahead.
Can hear you, Jeffrey.
Thank you. I'm Geoffrey Mutali. I work as a community health volunteer in a health center in Webuye, Milo Health Center. My community's name is called Milo B Village. I man about 100 households, close to 500, a population of 500 people. I've worked there for a total of 18 years. I have seen a lot of many changes in that village. There are so many things happening due to climate change. I do some RDT, that is rapid diagnostic and a test for malaria. It has increased. For the last 10 years, I was making, or rather, testing very few people. But things have changed because of the climate.
Let me do like.
What?
Please go ahead. Sometimes someone will unmute. Don't let that stop you. Please conclude.
For the last 5 years or so, due to the climate change, it has really increased. Malaria has really increased. I test for a day, I test about 15 to 20 people who test positive. So there are so many referrals to my health center. This one has already changed, and so there is need to work upon it. There are so many changes that have changed in this community. So for us to, what I've observed is that unless we work out very hard, there are going to be very serious ways in that community. I believe that if we can make a very big step, especially my health center, to get enough drugs, that is AL, antimalarial lumefantrine, which actually treats malaria. We must have enough drugs, but unfortunately, our health center has no these drugs because the government does not supply enough drugs to this health center. Thank you very much, but we need to rise up and do a lot of things that can make our community to live well. And at the same time, we need to get, the government should supply nets, that is long-lasting insect-treated nets to the community so that we can put away the mosquitoes, which are the most source of malaria. That is the female Anopheles malaria. Thank you very much.
Thank you very much indeed. And you made a reference to, and what sounded like a beginning of a call to action. In this special event, we're really focusing only on your observations, maybe some thoughts about how they related to each other. I'll be explaining and I'll be sharing at the end of this event, be doing two things. One is sharing what are the next steps, what are the next dates to put into your calendar. And second, also, we'll be sharing the full list of names of our guests of honor who shared their observations ahead of the event, as well as all of the locations, the communities, the towns, the cities, the villages from which these observations have been shared. Charlotte, back to you. I think we're close to we're going to hear the last few speakers and sharers of experience.
Yes, Reda. Okay, so we'll start with Halima. Lilian, just be patient. Halima will speak and then we'll listen to you. So Halima, over to you.
Okay, good afternoon. I'm Halima Usman Al-Khamis. I'm from Yobe State, of course. I'm the Director of Essential Drug Vaccines and Logistics, Yobe State Primary Health Care Board. I hope I'm audible.
Loud and clear, Halima.
Yes.
Please go ahead.
Okay. When you look at climate in Yobe State, most of Yobe State populace are farmers, of course, and then the desert encroachment, and then probably the recent flooding is actually taking away the fertile land away from people, and this is actually affecting the general overall health status of the people, because it's now taking our people into more instances of poverty, and this is also indicated by low scores in low indices in our RAMCA scores. Even though the government is doing all its efforts to alleviate the situation, but this, you know, this is nature, and then sometimes you cannot prevent the inevitable. And when we look at it, recently we are even having some small pockets of cholera around, because the rainfall last week actually led to some flooding in some of the LGAs in Yobe State. So this, when you look at it, these factors are interrelated. During the heat waves before the rainy season, we had some indices of people coming down with heat strokes, which actually led to death indices, morbidities, and mortalities, of course. So when you interrelate all this, you find out that the climate change, especially the recent changing waves in climate, is actually affecting people in your state. Thank you.
Thank you very much indeed. Yeah, before we go to Halima, Charlotte, I wanted to highlight this comment from, let me see if I can pull it up on screen. Let me see. Yeah, I may have to go back here. Yeah. All right. No, it looks like I won't be able to. But anyway, the comment is from Olajide Ugbemi, who's a reverend who salutes everyone and says, confesses to that the ongoing chat and knowledge sharing will help him and colleagues to develop advocacy work plans to engage decision makers to look in the direction of those whose health are being challenged because of climate change. So our goal was not a call to action. Our goal was to invite you to share observations and see what are the commonalities. What can we take away from sharing what we are seeing, what you are seeing as health professionals at the local levels. I believe, Charlotte, it is Wasim Zaman. Back to you.
We already heard from Wasim. It was
sorry.
going to be Lilian, but we've lost her.
Oh no.
Norbert Adrico. Your hand has been raised for a while, and
all right.
Yeah.
Okay, so hello everyone. I'm Norbert Adrico from Uganda, and I'm very glad to share with you this experience. I do volunteer with Uganda Red Cross site in Terago district, which is hosting a very many number of refugees in Uganda. In regard with health and climate, whenever someone talks about the climate change, you must know that there must be a health problem, and therefore I have to say that it is very important to note that it's our role. It is our role as the frontliners to ensure that we sensitize the community. We tell them about what they're supposed to do in order to avoid them being faced with such challenges, especially where I work in Terago district, which is hosting over 20,000 refugees. There has been a lot of deforestation, but we have encouraged them to do more of plantation of trees in order to avoid some of the bad impacts of climate, like flooding. These days, flooding is the key issue in Terago district, which shows that our climate has really changed. Earlier on, we used to have 2 seasons of rain, and now if you go right now, we have 1 season of rain in a year, and it's really alarming that people can't grow crops that can keep them for long, which has increased the hunger. There's malnutrition. Even right now, if you go for like blood donations in the areas, you'll find out that there are low levels of blood donation. And so because of this, I do encourage the community to take part. We work with them. We don't say that we know about these things. We tell them that it's our role to do what is right. And therefore, I I encourage everyone who knows about this calamity, this climate change, not to keep quiet, not to stay in the professionalism, work in front, to take the community as your partner and ensure that you work very closely with the cultural leaders so that we do it together, we solidify it in a short run. But if you say that, I know about this, you must do this, they will not know how to do it. This is what I just want to speak for in this meeting, because it's what I got from the front line in the communities. And with this, for the last 2 years, I've really achieved my target of reducing the high levels of diseases like malaria and typhoid, which have been the major diseases affecting my people of Terego district. Here, I beg to submit.
Thank you very much indeed. All right, we've got 4 minutes left in this event. It is time again, even if you are alone in front of your computer screen, really to share that commitment that brought you to this session, and the thinking, and already the thinking about action that you are doing as health professionals is absolutely remarkable. We're now going to review the announcements that I shared earlier. They're worth repeating. First of all, want to draw your attention to to an article shared with co-authored with our partner, Bridges to Development. It's about learning from frontline health workers in the climate change era, but it's really about articulating or beginning to articulate with you, by learning with you, why you matter, why you on the front lines in the districts and facilities, but also in the regions and in the national teams, you are positioned to make a difference, even if you are not a climate specialist. In fact, you may be able to see certain things because you work side by side with communities. Second, the first opportunity following this event is actually Wednesday, this coming Wednesday, in partnership with the University College of London, with the Relief Project team. They've been doing a lot of work on citizen science, and you are more than citizens because you have those health professional qualifications, but you'll be receiving an invitation if you shared your observations to this workshop on Wednesday to learn how you can actually turn these observations into science by using the methods and tools of citizen science. Next will be 13th of October at Teach to Reach 9. We'll be having a plenary session as well as networking, so you can actually meet, network, and learn with fellow professionals who share this concern, this worry, and who see climate change as a threat to the health of the communities that you serve. This will be part of the launch of the second version of the open source Manifesto for Global Health. We'll be sharing more details if you're not familiar with Teach to Reach. If you don't know about the manifesto, we'll be sharing all about that by email. We know we've been sending you a lot of emails, but it is for good reason. And then we hope, if you want to go further, and we already heard calls to action today, we have just begun engaging with the COP28 team, discussing a follow-up to this special event on the 1st of December, in which you, if you are ready to do so, and if this is what you choose to do, will be calling to action the global community, but as health workers concerned about climate change because you are seeing its effects every day. Now, we said we would end this session by recognizing and honoring everyone who shared their observations, and it is quite a long list. From those, we drew the list of our guests of honor. For those of you who did not get to speak today, as you can see, there's a number of follow-up learning activities that will lead us on that learning to action pathway. We'll be explaining as we go along, but I would like to share this list. Is an important list, and it's going to take a few minutes. We're going to go over time. If you have to go, of course you can, but we hope you'll stay in order to see the names of everyone who contributed. We always have some folks who don't see their name and think we left them out somehow. I promise you all the names are there, except for people who requested to be anonymous. want to congratulate each and every one of you who took the time out away on top of your daily duties in order to think about how climate is affecting the population you serve. As you can see, there are many of you, and we wish to honor each and every one of you. You are trusted advisors to the communities. And yes, Gifty, you can absolutely share your observations as well, of course. This is in alphabetical order by country. So we're now to Pakistan. And we hope that you've seen your name and are proud to see it here alongside with those of so many of your colleagues. We have a second list. If you need to go back to your daily duties, of course, please do so. But we'd like to also use shared observations from specific villages, districts, regions. We want to honor those as well. Ghana, Cameroon, Burkina Faso, Democratic Republic of Congo, Gambia, Mali, Nigeria, Ivory Coast, Tanzania, Eswatini, Guinea, Benin, Burkina Faso, India. All continents are represented. And we know that some of the locations where you shared your observations are being hard hit by climate change and having effects on health. The places where you work have names. We wish to honor those as well. Time to put in your messages as they can now be seen on screen. Tell us what you thought. You'll be asked, you'll be receiving a questionnaire so you can share your feedback and also the details on the opportunities that we mentioned. There's still over 180 people in the room, so I'd like you to share your comments, and also if you'd like to help reach more colleagues, involve more people to share their observations as we begin to build. Join and follow us on social media. I'll share with you, I actually don't like social media, but in today's world at the Geneva Learning Foundation, this is how we communicate, and this is how we can reach you and your colleagues and ask for your support in doing so. Once again, thank you, warm wishes to you. We'll keep the Zoom studio open and the live stream going so you can share final messages to say goodbye. Thank you very much indeed, and we'll see you Wednesday for those of you who want to go further. Thank you, Fanny Ogu, Oula Musa, Susanna Nkoma Sare Dieudonné Bou, Percival Agordo, Thank you. Namdi Fichineke. Thank you. And we appreciate your commitment and dedication above and beyond your job role, what you're doing every day, the work that you are doing every day to support children, families, protect them from disease and worse. Thank you, Monica Agu. And Loise Niacho. Obina Shigu, we enjoyed it. Even though these were dire observations. What we heard, what Charlotte and I have been reading that you shared is scary, has been scaring us. And we appreciate the courage that you have as well, sharing the observations and facing these challenges every day.
Away.